a look at this one. So this looks like it's a non-contrast CT. Thankfully, it's loading up. I know it's non-contrast because you can't see much in the way of what the kidneys look like. They look like I've got a piercing. So, I mean, I'm going to make a fair assumption that they must be young. Um, is that, I don't, maybe that's not a fair assumption. Apologies if it's not. Right. So now what we're going to do is, so this is, looks like a non-contrast study. We can see there's no contrast here. Let's scroll all the way down to the very, very bottom. Nothing going on there. We can see they've got an IUD in situ. Doesn't look like there's much in the way of inflammation. They've got abdominal pain. So what I usually do is try and go by a very systematic method. So let's look at the gallbladder. Gallbladder looks okay. Let's look at the pancreas. Not like the last one. This pancreas looks very, very smooth. It looks quite well defined. So that looks okay. Adrenals look okay. Spleen looks okay. Let's have a look at the bowels. So we'll quickly go through the bowels. Can be difficult. Scrolling this way, this way. Where does it go? Looks like it does a bit of a twist here, twist here, maybe. Then all the way up. The bowel up there, up there. We're up to the splenic flexure. Yeah, splenic flexure. Yeah, loads of answers coming through. Good. Transverse colon, hepatic flexure all the way down. Let's see if we can find the appendix. I always try and make sure that in every case I can identify the appendix. And I reckon it's be quite difficult on this one. Be very, very tough. But I reckon that thing there, can you see that? Might be the appendix. Very, very thin, tubular thing. Can you see that? So I reckon that's the appendix, and that looks normal as well. So then, yeah, people have done it. Yeah, so let's look at that kidney there. That kidney looks okay. Not much going on. This kidney, though, let's have a look. There is a calcification located in there, or calculus. There's two. One, two. Now we're going to have to make sure there's no obstruction. That ureter looks okay, doesn't it? Let's follow that ureter down. Can be a bit difficult. It's going to be one of these. Coming down, coming down, coming down. I feel like I've lost it, but it would be somewhere around here. I feel like I've lost it. Let's go from the bottom if possible. So that's going to be the vesicular junction. Coming up this way, I think it'd be in this area over here, isn't it? Coming up, but I haven't seen a calcification. It'd be anterior to the psoas muscles. No calcifications there, so it's probably not going to be. So either it's going to be a recently passed calculus, but I don't see any hydronephrosis or anything like that, or hydroureter. But what you do have is this fat stranding. For those that can't see it, if you zoom into that fat there, compared to that fat there in the subcutaneous tissues, this looks a bit kind of cloudy. So therefore, you probably want to go along the lines of this likely to be a pyelonephritis, younger patient more likely to be as well. Yes, it could be recently past calculus. Look at the white cell count, look at the CRP, look at the urine dip, see if there's any blood in the urine, and that may help you try and identify what it is. But yeah, this is I think I went with pyelonephritis on this one based on the clinical history and the white cells being up.